Good evening, stakeholders, and thank you for taking the time to be here tonight for this discussion on pediatric asthma and the impact it has on our wonderful community and children. My name is Robin Sis, and I'm currently the public health leader of Holyoke, Massachusetts. And tonight I'll be presenting on the Pediatric Asthma Health Promotion Project put forth by the Public Health Department. Asthma touches the lives of so many Americans, and it is one of the leading chronic diseases for the pediatric population within the United States. The state of Massachusetts has some of the highest rates of pediatric asthma. In fact, 1 in 9 people in Massachusetts have asthma, which accounts for nearly 13% of children living in the Commonwealth. The report Asthma Among Children in Massachusetts from 2017 reveals that only 2/3 of children diagnosed with asthma living in Massachusetts stated they actually had good control over their condition. This statistic demonstrates that 48% of the Commonwealth's asthmatic children live with uncontrolled asthma. There are 11 high-risk communities within the Commonwealth that have been identified with high rates of uncontrolled childhood asthma. Unfortunately, our city, Holyoke, Massachusetts, has been identified as one of those cities. Because of the statistics related to this public health concern, a community assessment was performed and a population diagnosis was made by the health department. The community diagnosis is as followed: children at risk for uncontrolled pediatric asthma as evidenced by the increase of pediatric emergency room visits and hospitalizations, along with increased reports of school absences, all related to asthma happening here in our own city. So why does this matter? Uncontrolled childhood asthma matters on both a national and local level. Nationally, there are on average 13 billion missed days of school and mostly affecting the age groups of 6 years of age to 12 years of age. In 2015, the United States medical costs related to asthma was $50 billion. The statewide average for students with asthma here in Massachusetts is 12.1%. In 2017, 869 students in Holyoke, Massachusetts, out of 4,300 have a diagnosis of asthma, which is 19.9%, almost double the state's average. In addition, in 2020, our community health clinic saw 3,170 children, and 950 of those children had a diagnosis of asthma. In the last few years, Holyoke has witnessed an increase in emergency room visits, hospitalizations, and school absences. Research shows that uncontrolled asthma can lead to a decrease in quality of life, both emotionally and physically for children, along with above average amount missed days of schools, and also it drives up healthcare costs. There are definitely certain variables correlated with high prevalence of asthma and uncontrolled asthma. 77% of asthmatic children reside in families that make less than $30,000 per year. In the state of Massachusetts, greater amounts of asthma exist among children that grow up in lower income families, that have lower education status, and are living in urban neighborhoods that have air pollution and a variety of other environmental triggers. The strategic plan for asthma in Massachusetts, the 2015-2020 program, does calculate that hospitalizations among Black American children are 2.5% higher than white children and 3.5% higher among Hispanic children than white children. Holyoke, Massachusetts is one of those 11 communities that share these health disparities, which can lead to a higher level of asthma inequalities. The large presence of Hispanic asthmatic pediatric population, in conjunction with low-income housing in urban neighborhoods, along with documented poorer air quality, all contribute to increased case counts of uncontrolled asthma within the city of Holyoke. Our pediatric population ages 5 to 12 are at greater risk for developing uncontrolled asthma. And as stakeholders from around the community who are present here tonight, from the Holyoke Medical Center, the Holyoke Community Health Center, the Holyoke School Committee, representatives from the Department of Education, and our own public health department. Together, we can improve the lives of our children and produce better healthcare outcomes for all if we act now and develop strategies to improve our asthma statistics. The population that this program is intended for is for students with a diagnosis of asthma that are enrolled in the Holyoke Public School System ages 5 to 12. This plan will be developed and implemented over 1 year, 2023. Our plan has interventions that are individually focused, community focused, and system focused. The first intervention involves community collaboration and coalition. A public health nurse will meet with the superintendent of the district, the school board, the medical director of the local emergency department, director of the local clinic, and the Pioneer Valley Allergy Foundation. Together, they will develop a task force, objectives, and goals. Next, we have 3 interventions that are related to disease and health investigation and disease surveillance. One system-focused intervention will be that Holyoke Public Health Department will collect data on pediatric asthma emergency room cases and hospitalizations at Holyoke Medical Center. Another system-focused intervention will be that the Holyoke Public Health Department will also collect data from the in-town elementary schools regarding asthma related to absences during the school year. A community-focused intervention will be that the public health nurses will then take all of this data they have collected and they will present the data related to school absences and hospitalizations and relay this information to the community primary health providers at the local health clinic where many in-town asthmatic school-age children are treated. Next, our program will move into health education. An individually focused intervention will be that public health nurses, along with school nurses, will provide 2 evening asthma education sessions for students with asthma ages 5 to 12. Lastly, we will have a policy and development and enforcement intervention. The program task force will then target local government to advocate for an asthma-friendly school policy across Massachusetts public schools. These interventions will have SMART objectives and goals attached to them as well. So for instance, if we look at our community-focused collaboration coalition intervention, the task force will be developed at the very beginning of the program, so it will be developed by the end of fall 2022. Then, in terms of our interventions that are related to surveillance and disease health investigation, the program's task force will demonstrate an 80% of tracking completion rate by public health nurses for 3 months at the beginning of January 2023 to the end of March 2023. This data will be related to pediatric asthma hospitalizations, emergency room visits, and school absences. The task force will then present this data by April 15th, 2023 to all of our program's partners and stakeholders. Next, goals pertaining to the education session will be measured by a 20% increase of improved sleep among asthmatic children who attended the educational sessions, as evidenced by the completion of family surveys. Toward the Toward the end of our project, we are going to have a task force that goes out and advocates for a asthma-friendly school policy. And this will have a goal that will be for the upcoming school year of 2024. We hope that this policy will be in place by the beginning school year of 2024. In conclusion, our larger long-term goal is to see a 10% decrease in school absences and a 10% decrease in emergency room visits and hospitalization by the end of 2024. Thank you for attending this presentation, and our task force looks forward to improving the lives of our children together with our community. Thank you.